Hi, I am Erin McCabe and this is Take 5. Several of the participants at last Sunday's Faith, Family and Freedom Alliance consultation have expressed dissatisfaction with the way in which the public health authorities have handled the reporting of COVID-19 cases in relation to churches. In the words of one participant,
but it must be said that whenever there was any event that involved a church, it was heightened. It was the tone. We talk about tone tonight. The public got the impression that churches were super spreaders, and the way the information was doled out was very unfair. It was a church spread, a church spread, a church spread. And we have investigated some of these church spreads ourselves. And in some cases, the manner in which these persons were handled was many times left much to be desired. If there is a spread of the church, was it because it came from the church, or were people who are members of the church caught that virus elsewhere, and because they came to church, that church is now said to have these many people?
Pastor Paul Leacock was speaking at a 2.5-hour COVID-19 Zoom consultation hosted by Bishop Joe Atherley and the FFF Alliance, which claims to represent a majority of evangelical Christians in the country. Mr. Richard Carter, another participant, raised the issue of social distancing on public transport.
There's no 6-foot distancing in any minibus that is carrying passengers. So I'm just trying to understand why we are insisting on 6-foot distancing when we have a public transport system which is carrying thousands of passengers to and fro every day. Why is it that in those minibuses you can sit in less than 3 feet in some cases?
In response, Dr. George stated,
The fact of the matter is that the evidence shows that we had significant transmission in congregations in Barbados. That is an undisputed fact. And as I indicated, there were 2 congregations, one which had a total of 175 contacts out of that single congregation. And secondly, there was another church with 85 contacts in total. We can't allow this to happen.
Also in attendance were Dr. Linda Williams, President of the Barbados Association of Medical Practitioners, and Mr. Ronald Chapman, head of the COVID-19 monitoring unit. Dr. Williams indicated that she was in favor of equal treatment of all concerned.
I am always been an advocate for the rules being applied across the board, not just singling out any institution or institution, because as I said, COVID loves a crowd and it doesn't matter where the crowd is.
Mr. Chapman's intimation that the church was instrumental in designing their own COVID-19 pandemic protocols came as a surprise to many in the meeting. Mr. Atherley expressed doubt about the scope of that alleged consultation and indicated that it would have to be reviewed. It was also revealed in that meeting that churches had been allowed a service time of 1.5 hours. Dr. David Durant of Restoration Ministries wanted to know whether the COVID-19 unit had any plans of allowing a 2-hour meeting time. In response to queries for possible time concessions for the Christmas season, Dr. George had this to say.
So with respect to, we have to be ever vigilant with respect to the holidays. COVID doesn't respect a particular day of the week. And therefore, we certainly will be very vigilant around that time. Please recall that there are many sectors that have particular interests. So the church has interests around Christmas and New Year's.
Efforts to get Mr. Chapman to explain the science behind the time frame of 1.5 hours were unsuccessful. As part of his contribution, Dr. George also disclosed that government would be rolling out vaccinations for children in the 5 to 11 age group.